Students, today we are ready to learn the next point, remedial and preventive measures in the lesson disaster management. Our first point will be to know how to gain information about what is happening around us. The first pictures, there are 4 pictures shown on the screen. The first one is TV. Next one shows you a laptop with a website www.imd.gov.in. Then comes a radio and finally a mobile phone. What do we gain from TV? TV can show us few news channels. News provide us with various information which we are not aware of. Sitting at your home just and clicking onto a news channel will give you lot of information. This information will let you know about what is going on around us. Why this information is important? We should know what exactly happens around us. What is the next picture showing? The next picture is showing you an important website. imd.gov.in provides us the weather forecasting of the section of where India is present on the earth. Why is weather important for us to be known? We should know when the rain will be or when the wind can be, when the storms can come, so on. That is why it is important to visit the website www.imd.gov.in. The third picture shows you a radio. Although news channels provide us with various newses, radio also is a governmental operational institute which provides us with news. And the last comes with a mobile phone. Mobile phone helps us with different actions, activities immediately reach to us. For example, if your relatives are present in America or in London, you just make a phone call and you'll come to know what is happening there. How are the situations present there? These are the benefits of mobile phones. What can you see on the screen now? First one picture is showing you about one first aid center where a man is sick and there are 2 doctors providing them with health care. Second one, a person is lying, sitting, trying to save himself below the table. And the third one is fire, where fire extinguisher does the work of closing the fire. What all these situations are? In the first one, a person is doing first aid. Second one, why does a person sitting below the table? He is trying to save himself from the earthquake. If there is an earthquake, obviously your house may have some chances to break down. That person knows if he wants to save his life, he has to sit under the table so that nothing can harm him. At least he can save his most important part of his body, that is the head. His head will not be injured. He is safe and secure under the table. Nothing can fall on him. The next one is fire. With the help of fire extinguisher, you can immediately close off the fire. First aid. Immediate medicine treatment to bring the injury into control. First aid means the immediate medicinal treatment which brings the situation into control. Let us study some disasters. First point is external bleeding. If a person is bleeding, first make him sit or lie down comfortably. Keep the bleeding part of the body above the level of the heart and clean it with water. First of all, what do we have to do? We have to keep the injured part above the level of the heart. Now, why above the level of the heart? So that the blood circulation is not done in much proportion where the part of the body is injured, and the lot of blood will not be given out of the body from the injuries. That is why you should keep the injured part from the body above the level of the heart and then clean it with good water, clean water. Burns and scalds, minor burns and serious burns. What can we do for minor or serious burns? First of all, what we have to do all is wash it with clean water. Provide him with a glass of water. The person should first of all drink water so that whatever water is lost from his body, he gains it after drinking the water. After that, we should wash the wound with a clean, soaked antiseptic solution. Do not apply oily ointments. Cover wounds using dry dressing. Why do we have to not apply oily ointments? So that oily ointments make the wound more. That is why we should not apply oily ointments. We shall remove the jewelries, shoes, etc. if easily possible. But if it is not possible, do not force to remove the jewelries or shoes, etc. Give an emotional support for the victim. Victim means the person who is suffering. He is called as the victim. And get medicinal aid at once. We'll turn to the next point now. Sunstroke. When we work in sun continuously for a long time, the body loses a lot of water and minerals. That is the reason for sunstroke. Now, what remedies can we do for a person with sunstroke? Take a patient to a cool place or in the shade. Sponge the whole body with cold water. Place a cloth soaked in cold water on the neck. Give plenty of water or liquid like sherbets to drink. If the patient feels like vomiting, make him lie prone. That is, his or her abdomen with the head turned to one side. Get medicinal help to shift the patient to the hospital. First of all, we have to take the patient in the shade so that he should not be suffering more again with sunstroke. Then we should wipe his whole body with the help of cold water, because when you have a sunstroke, your whole body loses water. When you wipe the body with the cold water, it will again give water to the body. Drink lot of water, which will provide you again with dehydrated person will get water again. And immediately contact the hospital. Snake bites. Snake bites are again injurious. Wash the wound with water. Give emotional support to the patient. Tie a cloth tightly above the wound. Get immediate medicinal help. Now, why we should tie a cloth above the wound? So that poison which is already present on the wound should not travel to your whole body. Dog bites and remedial measures on it. Wash the wound with a solution of potassium permanganate or other antiseptics. Cover the wound with a clean and dry cloth. Get a doctor's help and injection of an anti-rabies vaccine. We should first wash the wound with the help of potassium permanganate solution or any other antiseptic. Then cover the wound with the clean and dry cloth. And then we should contact the doctor for the medicine and the injections. Here we finish up with the lesson. Thank you.